So as our medication is infusing our secondary, we want to make sure too that right away we go ahead and we sign our MAR. We also want to make sure that we account for the fluid given in the in and out balance. So 115 mLs of my infusion. Okay, and then because we put our infusion to manual, it's going to beep and call me back when the infusion is done, when the secondary infusion is done. This is a really good habit to get into because we want to make sure that this dose has gone in. If we forgot to open the roller clamp, then it would pull from the primary, we would come back in 30 minutes and none of our medication will have infused, okay, which would be a medication error. The other thing that's really important to do as well is when you hang your piggyback line, make sure you label it so that we know when to change it. These lines as well are good for 96 hours, assuming that they are not contaminated. If they get contaminated, make sure you change it, okay? So you can hear, now it's alerted me that my volume to be infused in the mini bag has gone in. So I would come back into the room, do my hand hygiene. Hi, I'm just coming to check your pump here. Okay, so yes, I see that the volume to be infused has infused. If there was still some medication in here, I would program some more volume so that it empties the whole mini bag, okay, so that it completely goes in. That's why it's really nice to incorporate overfill so that we ensure that the mini bag goes empty. It is fine if air gets into this tubing because when we back prime the next time we use this tubing, we can get the air out no problem. Now there is some medication that will stay within this line and that's okay. If you work in some specialty areas such as pediatrics, it might be really important to clear this tubing, but for the adult population, we can leave this medication tubing in there, that's fine, okay? It's a very small dosage amount compared to the whole volume that your patient will get. What is really important though is that our medication will actually be sitting in this line right now. So if we go back to our primary infusion of 25 mLs an hour, the medication vancomycin that's sitting in this line will sit here and flow to our patient very slowly. Eventually it'll get to our patient. But if we were to go ahead and give an IV push or anything like that, it would mix with the vancomycin. So we don't want anything sitting in this line except normal saline. So what we're going to have to do is we're going to have to flush this IV line out and we're going to fool our pump actually. So what we're going to do, we've acknowledged that our medication has gone in and the mini bag is empty. So that's perfect. So we're going to take off, we're going to program another secondary. This time, the back to primary, we can flip it to automatic. We know our medication has gone in. We don't need to be called back again, okay? So we're going to flip that back to auto change, okay? So that way it'll automatically switch back to the primary after it's done flushing, okay? So I'm going to go back up. I'm going to go new secondary and go okay. And again, antibiotic. And the total dose, we're going to put in 15 mLs. Why 15 mLs? The reason being is from the pump to the patient is about 15 mLs of tubing, okay? About 15 mLs of vancomycin that's sitting in here. So that's why I chose 15 mL flush. We're going to go okay. Now it's going to ask me the time. So this one's a bit tricky. We're going to go down to the minutes and we're going to go up. And you can see in the bottom left corner, it's going to tell you the rate. So we're going to keep pushing that arrow up and you're going to see the rate is going to get lower and lower. Now it's going to be helpful to remember what your infusion was running at before. So my vancomycin was running at 230 mLs an hour before. So I'm going to keep increasing my minutes until I get to about 230 mLs an hour. We don't want to go faster than 230 mLs an hour because that's going to mean it's going to push in all that vanco really quickly, which might be detrimental to my patient, kind of giving them a big bolus of vancomycin, and that's not very good. So 225 mLs is pretty close. In fact, it's just a tiny bit slower, and that's okay. Slower is okay. Okay, so that's going to run over 4 minutes. So if we had to keep going, if we needed a lower mLs per hour or a lower rate, you would just keep increasing the minutes. Okay, and you can see that it'll just keep adjusting. Okay, all right, so then we're going to go okay to confirm. And then we'll go start. Now, because this is empty, I'm going to roller clamp that closed. What that is going to do, and I'm going to turn this so you can see, oh, and it's going to also remind me about the height. Okay, so I'm going to press start. Yes. Okay. So I've basically just fooled my pump because the pump doesn't know where it's pulling from. I fooled my pump into thinking I'm giving a mini bag when I'm really not. What I'm doing is I'm pulling my flush from this normal saline primary bag and I'm forcing it through the pump at the same rate that my Vanco went through. Okay. After 4 minutes, this will silently go back to the primary of 25 mLs an hour. Okay, so right now it's flushing that vancomycin slowly to my patient.